COVID-19 tests have been in high demand. As the lines at free testing sites get longer, many are turning to private clinics. But that comes at a price. NewsNation correspondent Rob Lowe has more on the cost of these tests.
The line of cars at Monaco and Evans is a big hint people are here to get a COVID test. But what you pay depends on whether you have insurance or not.
And what's it cost if you don't have insurance? I do, but...
$180 just for the swab.
I happen to get a COVID test at this privately run location myself, not worried about the cost since my insurance was picking up the tab. But Scott Fitzgerald says I probably should have been more concerned, like he is.
Because I really do think it is money out of my pocket, because I think that my insurance company is getting treated unfairly.
Fitzpatrick got tested in the same place I did.
For a total of $787.
And what did you think?
I about fell out of my chair.
$277 is called a physician fee. In reality, that's the office visit. Yep, the parking lot is considered a medical office when it comes to billing insurance. Folks without insurance pay a flat $95. Then there's a $150 lab fee for the antibody test. If you don't have insurance, that's a flat $45. Then it's $300 for the nasal swab. Folks without insurance pay $85. Then this COVID drive-up charges insurance $30 for what's called a Colorado OBGYN fee. We're told that's for handling the specimens. And finally, there's a separate $30 lab fee. We're told that's to pay for staff PPE or personal protection equipment. So Scott's insurance, Cigna, gets charged $787, which Cigna negotiates downward in this case to $397. But that is still nearly twice the $225 someone without insurance pays out of pocket for both the swab and antibody test.
If you charge my insurance company outrageous rates, they in turn are going to turn around and pass that on to me.
If you're wondering, Medicare's reimbursement rate for a nasal swab COVID test is $100, but there's no law, no cap on what a private facility can charge an insurance company. The trade group known as America's Health Insurance Plans, or AHIP, released a fact sheet that states price gouging in COVID-19 testing is a significant problem.
I just kind of felt like this company and this physician and his partners are taking advantage.
So far, we haven't made any profit on this business.
Dr. Steve Volan is the doctor who operates this drive-through testing site.
By running an outdoor drive-up testing site, we're able to keep people out of the emergency room, and therefore we feel that we're reducing healthcare costs.
Dr. Volan says he's not gouging insurance companies. In fact, he says he's yet to make a profit because insurance companies take 60 to 90 days to reimburse his claims, plus reimbursement rates vary, and insurance companies reject up to 20% of his filings.
We're trying to increase access to as many people as we can.
To some extent, he says insurance companies help subsidize the price for people who don't have insurance to keep the price that they do pay lower.
There's always unscrupulous people out there, but we're a mission-based organization.
Rob Lowe, NewsNation.
Interesting stuff. NewsNation is also keeping track of the average cost for a hospital stay for coronavirus patients. Data from Fair Health shows the charge is usually around $73,000. Insured patients wind up paying closer to $38,000. Fair Health analyzed 30 billion private health care claims to get to that number.